Good evening. Today we will be talking about the use of immersive virtual reality in crisis de-escalation training for first responding police officers. This will be a qualitative approach for social change. Fatalities related to police encounters of consumers with mental illness has become a public health issue. A lot of us are asking, how can we train police officers to do a better job? But the reality is that an 8-hour to 40-hour training may not be enough in order to equip police officers with the skills they need to assess, discern, and intervene. In 2015, the Washington Post conducted the first ongoing tally of police officer involved shooting deaths in the mentally ill. Nationwide, at least 25% of those who were shot by police officers were suffering from an acute psychiatric mental illness. Those people with mental illness are 16 times more likely to be fatally shot during an encounter. It can be argued that mental illness isn't the only factor involved in fatal police encounters. Aside from race, the link of mental illness to police brutality doesn't have the same publicity. In 2015, in New York City, the police department responded to more than 400 mental health calls a day. That's 12,000 per month. Historically, the perception of people suffering with mental illness as violent and dangerous is another reason why police officers are often called. Police officers are the only people perceived by the public to be able to de escalate a mental health crisis. According to the American Psychiatric Association, most people with mental illness are not violent, but using law enforcement as a blunt instrument contributes to the stigma. Fatal police shootings, especially when they involve a person suffering from a mental illness, are not new and they're not rare, nor are they going away. However, there are things that we can do, and this study will focus on specific research questions that tap in on the experience of police officers firsthand as they discuss their experience when managing a psychiatric crisis. The objective of this study will compare outcomes of immersive virtual reality and crisis intervention trainings to traditional platforms to assess if police officers feel equipped to understand, assess, and de escalate a psychiatric crisis when called for a community response. The research questions will focus on the following: how will immersive virtual reality advance the skill acquisition for crisis intervention training when compared to traditional classroom training methods, which are 40 hours, and police officers responding to an acute psychiatric crisis? Our second research question will focus on the areas of traditional training format, how they will be used to demonstrate the effectiveness of implementing an immersive virtual reality enhanced assessment skill in police officers in order to identify an immediate psychiatric crisis and initiate a crisis intervention. Lastly, in what ways will an immersive virtual reality training format build assessment intervention skills in police officers responding to an erratic psychiatric crisis in order to reduce fatalities, brutalities, and outcomes of the subjective and or the officer? This study is built upon the theoretical framework of reconstructive critical theory. As a behaviorist, I understand that environments such as a classroom and learning centers offer a space to develop and shape learning. The process of evocation and elicitation allows one to actively take part in shaping a world through informed decisions. In order to understand the live experience of the subjects, individual interviews will be used for questions. along with case studies to gain a background and to get a statistical history. Although with qualitative information on research, statistical data is not as relevant as the actual experience, we will also use note taking and tape records to capture the answers. Police officers will be interviewed on several categories, including their demographics, their experience, their training, and their understanding of the social justice issues. The study will be based on a phenomenology approach in order to understand the life experience of police officers called upon as first responders to manage erratic behaviors associated with a psychiatric crisis.